Months before the Pulse tragedy, Orlando Health and the FBI teamed up for a training drill at ORMC. Many credit this drill as the reason so many lives were saved on June 12th.
News 6 investigative reporter Erica Washington joins us now. And Erica, the timing of this drill couldn't have been better.
Absolutely, Lisa. This drill took place in March, and there were 50 law enforcement agencies, 15 hospitals involved, and over 500 volunteers. This took 4 hours. Now, this was the hypothetical scenario, is that there was an active shooter with hundreds of casualties. Now, what no one knew is this training would be put to the test a few months later.
Because of what we did back in March, that helped us understand what they would need to do in a real situation.
No one could have imagined that real situation would be America's worst massacre, the Pulse shooting. Eric Alberts of Orlando Health put together the drill in March because of recent active shootings that had taken place across the country. Alberts knew the FBI needed to be involved in this exercise.
One of the things that we know working with our FBI partners is that they're going to have to come and interview the patients, their families, anyone that was really in that situation to try and find out the story. We really need to practice this piece because we've never done that before.
FBI Special Agent Ronald Hopper says success equals everyone being on the same page.
That training exercise was absolutely essential because, as I mentioned, we don't normally work just or focus on the medical portion.
How important is it to have those agents in the hospital relaying that information back to the command post?
Those people are your best witnesses. They were the ones that were there and witnessed it firsthand. It could be something as simple as overhearing someone coming into the hospital just regurgitating something they saw or heard during the incident.
In this drill, his agents practiced doing their job without impeding doctors from theirs.
The nursing staff or the intake staff says, hey, this person can wait a few minutes, you need to hear what they have to say. That happened in a lot of cases because we needed to make sure there wasn't a second shooter. And because of that training, we knew what to do, we knew what questions to ask, we knew how to ask them without being in the way.
In a tragedy, time is of the essence. Where do I go? What do I do? Dr. Smith says this training helped answer those questions.
It gets people to where they need to be to accept this influx of patients, but it also puts in the whole team's minds who needs to go where. We train our whole careers for something like this and hope that it never happens.
But if it does, having a plan in place is priceless.
You hear the feedback. What we did during that exercise really helped save lives that night.
Now, Orlando Health has already started planning for next year's training drill in April. It will include 4 counties, even more hospitals, and more victims. And no doubt the FBI will also be involved in that training, too.
All right, Erica, thank you. Well,